Welcome to Premier Place. My name is Cassandra Panting, and I'm the Director of Marketing and Sales here at the Glenview. Today, I'd like to take you on a tour of Premier Place, which is our skilled nursing and rehab health center. I'd also like to introduce you to a few of our clinician team members at Premier Place. But first, why don't we take a tour of several of the common areas as well as a patient room here at Premier Place. Here we are in the living room. This is absolutely a gorgeous living room and dining room. The Premier Place has just undergone a $11 million renovation a little over 2 years ago. It is light, it's bright, it's very airy. Come and take a look. This is our dining room area. Of course, we encourage our guests to come and enjoy this dining room, but they certainly can eat in their room. We have an executive chef as well as a full-time baker, and the food here is very, very enjoyable. We're in our activities area, and we have a full-time activities director. We have 42 private rooms here for our guests, and that includes an ensuite for each room. As you can see by the hallways that we have, we keep it nice and clear, and it looks very much like the health center that it is. This is one of our 42 guest rooms. Come and take a look. It's rather large, and it also has an ensuite bathroom. We are in the office of Juan Ricardo. Juan is an RN, and he is also the Director of Nursing for Premier Place. He has been that director for the last 12 years. Juan, what type of surgeries and chronic medical conditions does Premier Place provide the nursing services for?
Yes, Cassandra, we provide nursing services for orthopedic surgeon, surgical operations with post-op surgical patients. Those medical patients recovering from a stroke and congestive heart failure, cardiac protocols we have in place, patient needing IVs, therapy, and other nursing therapies.
What are some of our specialty services?
Yes, well, I have already mentioned several specialty services. I am also an infection preventionist here at Premier Place, and we do provide therapies for infection disease as another of our specialty services.
What about if a person from the community only needs respite care for several weeks because their main caregiver is going on vacation?
Yes, that's a very good question. Yes, we provide respite care of the communities of Naples and Fort Myers. Many people like to use our Premier Place for their respite care. Premier Place is designed for short-term acute care, but also for long-term care.
Can a person stay in Premier Place long-term or as a permanent resident in Premier Place?
Yes, our holistic and customized approach to every nursing care by our nurses, CNAs, and healthcare workers allows for excellent outcomes for those people needing skilled nursing care, temporary or full-time.
Well, thank you very much, Juan.
You're welcome.
Hi, I'm in the office of Maria Preto. She's a registered nurse as well as our admissions coordinator for Premier Place. She really is the liaison between patients being discharged from the hospital and coming to Premier Place. Maria, can I ask you a question about the process a person undergoes who is being discharged from a hospital and wants to come here to Premier Place for their nursing, skilled nursing, as well as rehab?
Yes, the process from the admission when patient been discharged from the hospital and they in need for rehabilitation, a skilled nursing facility. So usually it's a simple step. So they need to let the case manager at the hospital that they are planning to come to us here, and that is so from there on, so we take care of those. So usually the case manager contact me by phone or by the power charge, and we start reviewing the patient, and as soon as we have the discharge date for them, so we start the process.
If a person is going to have elective surgery and they want to come to Premier Place for their rehabilitation part, how do they begin and when should they begin in order to be having a reservation?
Usually when the patient gonna have elective surgery, they need to have a pre-operations appointment with the surgeons, and there is when they need to let the surgeon know that they want to come to Glenview for rehabilitation service for a skilled nursing facility. So usually that is simple. So the surgeon fax over us all the paperwork that about that patient. We usually contact that patient with the information, explain how is the process, and when the patient goes to the elective surgery, so the case manager let me know. That's it. So we take care from there on. So they only have to let the surgeon know that the patient that he want to come to us. That's it. And we usually make sure that we have the bed reserved for that patient, because they choose us as primary care after surgery for the rehabilitations.
Well, thank you very much, Maria. This has been very informative. Thank you.
You're welcome.
Part of our $11 million renovation included the rehabilitation department. I'm here with Brian Jacobson. He is our Director of Rehab. Brian, can you tell us what types of patients are treated here in the rehab department?
All right. We treat a multitude of different patients here, mostly orthopedic patients getting new hips and knees, but many different other conditions. We provide physical, occupational, and speech therapy here for our patients that stay here, as well as we do provide outpatient services here for a multitude of different cases and conditions.
Thank you so much. I hope you enjoyed your tour of Premier Place, as well as meeting some of our team members and getting those commonly asked questions answered. But if you have any other questions, please don't hesitate to call at the number following this message. Thank you so much for tuning in.